These are instruments that are on the C-section tray, and we're going to explain ways to use them during a section. So this is a hemostat. You can use this with a bovie for bleeders to help tag suture, or a sponge that they need to tuck back something. This is a Kelly. We will use this to clamp the cords when they pass the baby off. This is an Alice. You can see the teeth here. This is what they use to test the patient's skin. And you also can use this on the uterus. This is a Schnitt. They will use this sometimes to carefully dissect through an area of tissue that they're not sure what could be underneath. So they'll use this with the bovie. This is a Coker. You can see it has a tooth here. They use this on the fascia to help grab it when they're dissecting, and then when they're suturing it back up. This is a needle holder, and this is used to hold suture during the section when closing. This is a Babcock. We'll use this to hold the fallopian tubes out of the way when they're removing those. This is a T-clamp. They'll use this to stop bleeders on the uterus. Sponge stick. They'll use this if there is a tear like further down, or you can also use this for a vag prep. We have 4 pairs of scissors. So this is the bandage scissor. We use this for if they have to cut the uterus, and then for the cord for the baby. These are our straight mayos, or your suture scissors, used to cut suture. Your curved mayos are used to cut heavier tissue like the fascia. And then we have Mets, which are for more delicate tissue, like making a bladder flap. These are the forceps that we use during a section. Here's our 2 knife handles. And then our forceps here, this is a Ferris Smith. This is commonly used for the fascia and the fat. It has teeth here to grab the tissue. And then this is the rat tooth, which can be used on the same tissues. This is a smooth or a plain pickup for delicate tissue like making a bladder flap, or using it to stop a bleeder with the bovie. These are our Russian forceps, which are used to close the uterus. And these are our Adson forceps, which are used when closing the skin. These are the retractors that we use during a C-section tray. These are the Richardsons. These will be used to retract when they're making the uterine incision, and they can also be used to retract when they are doing the fascia. These are Army Navies, usually used when retracting the fascia if the patient is smaller, or they would use these. This is the bladder blade, used to retract the bladder during the C-section to protect it. These are Devers. Again, you could use them for the fascia, or when they're placing the uterus back into the abdomen, they will use that to retract. And then this is a ribbon or malleable. This will be used to protect organs underneath when they're sewing the fascia.